Today we will be dealing with the study of starvation, medicolegal aspects. So the starvation may be acute starvation or chronic starvation. How do we define starvation? Starvation is defined as deprivation or deficient supply of food, which results in starvation. The acute starvation means there is complete stoppage of food or withdrawal of food, and in chronic starvation, the stoppage of food is periodical. Clinical features are for the first 2 days, within 30 hours to 48 hours, hunger and hunger pains occurs. And these hunger pains, they can be relieved by the pressure over the epigastrium. There is intense thirst within 30 to 48 hours, then the emaciation starts. By fourth day, there is a loss of subcutaneous fat. The fat is lost, and therefore there is emaciation of body. Bony points are prominent, eyes are sunken, glistening, and pupils are dilated. The lips are dry, tongue is dry and coated, furrowed with thick saliva. Voice becomes weak and whispering. The skin is dry, the hairs are dry, nails dry and lusterless and brittle. Extremities appear thin. Progressive muscular weakness will be there. Then, if the starvation occurs more than 5 days, the metabolic process will be in 3 stages. In first stage, initially the rapid metabolism of protein stores are converted by liver to glucose to maintain energy supply to brain, because the brain requires glucose for its function. Second stage is decrease in utilization of protein, shift to fat metabolism. And third stage, complete depletion of fat store occur. The metabolism again shifted to protein. By seventh day, there is a progressive cardiovascular weakness observed. There is a weak pulse, paroxysmal tachycardia is there on exertion, and the temperature is subnormal. The constipation or diarrhea may also occur. Urinary reduction in volume may occur. Urine is scanty. It is concentrated with acidosis. There is disagreeable odor of the body. Hallucinations and delusions may occur. Ordinarily, 40% of loss of body weight is fatal. The fatal period is 10 to 12 days if the food and water is stopped. But if food supply only is stopped, then the survival is about 6 weeks. Then what are the various factors influencing the fatal period? Age, very young and old age suffer most for starvation. Female withstand starvation better because the female has a body fat. Then state of health, fatty healthy person withstand the starvation better. The temperature, excessive heat and cold hastens the death. The exercise, active physical exertion hastens the death. Then in chronic starvation, what are the features? In chronic starvation, you get loss of well-being and hunger pains. Physical and mental lethargy will be there. There is progressive loss of weight. There is polyuria, cachexia and edema, hypotension and hypothermia, loss of self-respect and mental retardation, decrease in blood sugar, decrease in cholesterol, chlorides, and increase in non-protein nitrogenous substances. Then there may be infections. Then what are the postmortem features? The postmortem features, you will get externally emaciation will be there, muscular atrophy in general, and general reduction of size and weight. There will be pigmentation of skin with a disagreeable odor. There may be edema and ascites. Hair, nails, dry, brittle and lusterless. This is the picture of starvation death. You are finding here there is a general emaciation of the body, wasting of the body, and there is bony prominences are prominent, and broomstick appearance of the limbs. Eyes are sunken, face is sunken, abdomen is scaphoid. And then internal organs you will find reduced in size and weight. There is brown atrophy of the heart. This is a brown atrophy of heart. The size of the heart is decrease, and there is a brown atrophy of the muscles. The muscle mass is also atrophied. Then at autopsy, what are the differential diagnoses? Diseases that cause the loss of weight are Addison's disease, acquired immunodeficiency syndrome, anorexia nervosa, chronic diarrhea, diabetes mellitus, food intolerance, hyperthyroidism, malabsorption syndrome, malignancy, pernicious anemia, progressive muscular atrophy, pyroric stenosis, and common is tuberculosis. In India, these are the autopsy findings, differential diagnosis, one must remember. The internal findings, postmortem findings, all organs are less in size and weight except brain. Complete absence of fat, dental defect will be there, rickets in children, osteomalacia, stress fractures you may get, brown atrophy of heart we have discussed. Then gastrointestinal tract is transparent paper like with patches of ulceration. Gallbladder is enlarged with thick bile without any obstruction. This is very important. You will find reduction in size of all organs, but in gallbladder the size is increased. Gallbladder is enlarged. Then what are the medico-legal points? One must examine and give the opinion in cases of hunger strike. In cases of hunger strike, I will give one example, my example in the last. Then wasting diseases to be excluded. Homicide, act of omission for illegitimate child or unwanted child. Then old invalid persons, unwanted persons, they are omitted to give the food. And instant independence, where because of act of omission, the particular person may be killed. Accidental cases are seen in shipwreck, mine entombment, earthquake, famine, then flood. In these all incidences, the emaciation may occur, the starvation death may occur. Diseases like ankylosis of jaw, stricture of esophagus and pylorus, the starvation may occur. Suicide, hunger strike, exhibition for public attraction, the hunger strike can be done. Lunatics, hysterical person in which the particular person may die of suicide by starvation. Legal situation in India, when the starvation is there, force feeding, doctor may be sued for using criminal force. Doctor should not use the criminal force, but he should try to feed them possibly without the criminal using criminal force. No force feeding. If force feeding is not done, the doctor may be sued for abatement of suicide. So I will give you one example of my experience when I was lecturer in Government Medical College, Nagpur. There used to be hunger strike by Maharashtra resident doctors. Maharashtra Association of Resident Doctors, they used to go on hunger strike for stipend and other demands. Then at the third day, fourth day, the police were calling us for examination of the hunger strike persons. Then we used to go and examine the person. So one has to examine the BP, pulse, general examination, systemic examination, and investigation should be done. When BP is low and the acidosis is there in urine, then we used to give the remark that the force feeding is necessary. So in such cases, the force feeding is necessary. Then the police used to take them in the hospital, admit them, and the hospital applies saline, etc. Force feeding was to be given. Then Article 21, right to live, no right to die. Article 21, there is right to live, but there is no right to die. So there is no right to die by starvation. This is the fatal neglect and starvation in an infant because of act of omission. The food supply, the fluid supply is not given to the infant, and therefore you are finding over here the sunken eyes are there. The broomstick appearance of the limbs are there, scaphoid abdomen is there, bony prominences are very prominent, and the particular child died of negligence. is starvation death. Then 18-year-old man survived for 18 days without food and water after being put in a cell and forgotten by Australian police. So this is the example published in Guinness Book of Records. Then revolutionary Jatindranath Das lived for 63 days without food in British jail. The reference is Sansad Bengali Charitra Vidhan. The main references I have referred are the Narayan Reddy's book, Anil Agrawal's book, and Pille's book, and other references were also taken. Thank you very much for patient hearing. Thank you very much.